for sticking around. Well, today we are diving into a topic that affects us all, and that's our smiles. Whether you're considering braces or just curious about how to maintain a healthy mouth, we have the perfect expert here to help us with that. So Miss Anna Veilands with Veilands Orthodontics is here now with some advice. So welcome to the Town and Country. How are you doing today?
Thank you. I'm doing fine.
All right, Dr. Veilands, can you explain what an orthodontic is and why it's so important for our oral health?
Orthodontics is a branch of dentistry that involves lining up the teeth and the jaws, and it's very important for your oral health because it helps with the function of the jaws. Also, lining up the teeth makes it easier to clean and keep them healthy. It also prevents excessive wear and tear on your teeth, and of course it enhances your smile.
So at what age should someone see an orthodontist, and what does that initial consultant typically involve?
So the American Association of Orthodontists recommends that a child be seen at 7. I know that might seem early, but it's the appropriate time because the molars are coming in and the incisors are coming in, and we can better ascertain what the appropriate time would be to treat, whether we did something early or we did something late. It just usually involves the orthodontist taking some x-rays and some photos, doing an exam of the mouth and teeth, and then determining if we need to do anything early like expansion. But it helps to predict the timing.
So I've actually had braces myself when I was younger. I was in high school. I had it for about a year. But for those who don't know, how do braces work, and are there any new alternatives to traditional metal braces?
So braces are an orthodontic device that are used to move teeth gently with pressure. The wires thread through the brackets and moves the teeth. So that's the traditional way to do it. That's can be a little uncomfortable. An alternative to traditional metal braces would be the clear aligners, and they gently move the teeth as well, and it's more for someone who wants an invisible treatment, and it's because it's less noticeable.
Okay, now is it true that only teenagers need braces, or can adults benefit from orthodontic care as well?
No, it's not true about just teenagers. Adults can definitely benefit from orthodontic care, and more adults are choosing orthodontic care these days, where they weren't able to do it as a child for whatever reason. They want their teeth straight. They want them for aesthetics and for function as well. So yes, adult orthodontics is very big.
Okay, now as you know, technology is forever changing, right? So how has technology like 3D imaging or clear aligners improved the treatment experience for patients?
Well, 3D imaging is a great option these days. So the 3D imaging that we do is a CBCT x-ray, and it allows you to see more of the teeth, the bones, the soft tissues, and so you can diagnose better and treatment plan better. One of the biggest things that we do is we don't take the sticky, gooey, putty impressions anymore. We use an intraoral scanner. And because we use this, then the retainers can be made and appliances can be made, expanders can be made off of a 3D printer, and you don't have to go through that messy procedure. The 3D intraoral scanner is also what takes all the detailed pictures for the clear aligners and makes the clear aligners more precise and treatment more efficient and certainly less discomfort.
Okay, speaking of, now I'm pretty sure anyone can attest to being afraid of coming to any doctor's office, right? So what advice do you have for someone who's nervous about starting their orthodontic treatment?
Well, it's normal to be nervous about starting orthodontic treatment because it is kind of an unknown. I haven't met a patient that's not a little bit nervous. But just do your homework and look into the different options, and ask your orthodontist questions. Our consultation is complimentary, and we try to answer as many questions as we can so you better understand the treatment plan. So more knowledge is less fear. So the other thing is, anytime you have an adjustment, and you're going to have a little discomfort. So there's nothing that soft foods and over-the-counter pain meds can't fix, but just have to keep in mind you're going for that beautiful smile, and it's all worth it in the end.
Awesome. Now, for those who are watching, what is the contact information? How can they get in touch with you if they're interested in becoming a patient or just want some questions answered?
Well, you can look at our website. It's www.veilandsortho.com, or call the office at 229-883-7793.
Perfect. All right, well, we'll have all this information posted on our website at waob.com, but don't go away just yet. We'll have more TNC coming up right after this.